So my name is Alexis Edmonson, and I am a second-year medical student at Tulane University School of Medicine. First, I would like to thank my co-authors on this project and for allowing me to come and present today. So the title of my presentation today is Deep Venous Thrombosis After Proximal Hamstring Tendon Repair, and this was a systematic review that we performed. So proximal hamstring tendon injuries are common among athletes and are often caused by movements involving rapid hip flexion while in knee extension. So treatment of these injuries do include operative intervention. With operative intervention comes post-operative complications at times, and one of those specifically laid out in this review were deep venous thrombosis, or DVTs. So the purpose of this study was to characterize the factors related to the development and treatment of DVTs following a proximal hamstring tendon repair. So as I said, this was a systematic review, and we used the PRISMA, or the preferred reporting items for systematic reviews and meta-analyses guidelines. You can see our inclusion data and how we got these studies used in this review in Figure 1. So we did use PubMed and Embase, databases to find our studies. The initial search came up with 657 studies, 8 of which did meet our inclusion criteria. And our criteria included that these studies used in this review had to touch on the surgical technique used in the proximal hamstring tendon repair. They had to include patient demographics such as the age, sex, mechanism of injury, whether or not the injury was acute or chronic, and the number of tendons that were injured in the patients, and of course, whether or not the patients developed a DVT in the post-operative period. We also made sure that the studies included the post-operative outcomes for at least 6 months among their patients in their studies. So from this, and the 8 studies that we gathered, there were a total of 422 patients that we observed. And among those, there were 426 hamstring injuries. From that, there were 222 listed as acute, whereas 204 were listed as chronic. And a total of 9 instances of DVTs were found among the 8 studies included in this review. 2 out of the 9, or 22.2% of the DVTs, occurred in patients that underwent a repair for chronic proximal hamstring tendon repair. 2 of the 9 were found in patients that had a complete proximal hamstring repair, and 3, or 33.3% of the DVTs that occurred were seen in patients with a complete proximal hamstring tear. We did find that 1 of the DVTs that were listed among the 8 studies did not have any characteristics associated with the patient that developed a DVT in the postoperative period. One of the studies did report that they used DVT prophylaxis in their surgical patients. However, 1 out of the 52, which would be 0.02%, did still develop a DVT in the postoperative period. All of the DVTs occurred in studies following an open proximal hamstring tendon repair. And from this, we did see that the results from this study showed that more than half, or 5 of the 9 total DVTs, occurred in patients that had a complete proximal hamstring tendon avulsion. And important conclusions from this study include that there is limited data about patients who develop a DVT in the postoperative period after a proximal hamstring tendon repair. And although this is not one of the more super common postoperative complications in this surgery, it is still one that needs to be looked at, and orthopedic surgeons should still consider this and can help potentially implement a regimen for treatment and prophylaxis in their postoperative patients. And that is all I have. Any questions?
Thank you very much. This is very thoroughly researched, and there's I appreciate the breadth of initial kind of inclusion criteria and how things have been narrowed down. I wish I had a good question to ask you, but unfortunately I do not. It was very well explained, so thank you.
Thank you.
If anyone in the room has a question they'd like to ask, obviously this is an open forum, so please feel free to do so. All right, well, thank you very much. Appreciate you taking the time to be here and to speak with us.